may or may not know that local Healthwatch have a statutory power called Enter and View. Enter and View is something that we use to measure the quality of care in a health or care environment, and we do so by using trained volunteers called authorised representatives. It's really important because it gives us an insight into the kind of care or health service that a resident or a patient will experience, and we do so by speaking to staff, to the residents themselves, to family members and other professionals that are there at the time.
I've been training Healthwatch authorised representatives now for many years, and I think it's an absolutely key role for Healthwatch to be able to enter and view, because actually it's the report that's written at the end of it that's the key element. Authorised representatives enter and view premises to observe the nature and quality of the services, so says the legislation. But after that, they write a report which is aimed at improving things, and surely that's what Healthwatch is all about.
Of course, Enter and View would not be possible without the volunteers. They're highly trained. In fact, the training is ongoing. They come from a very diverse background. And once they've actually visited a place, they get together, look at and share the evidence. And the draft report is shared with the home, with the provider, to ask their views, and all their comments are included before it's published with anybody that has an influence on what positive changes can come about.
Personally, what I get out of doing the Enter and View visits and producing the reports is the satisfaction of knowing that I'm making a contribution to the local community and to the care that the council and the providers are giving to the people of Suffolk.
The whole Enter and View experience was very valuable for us. It was great to have trained people from another organisation coming in to see how we work, see what we do, and their feedback has been really valuable. Things were picked up that we may not necessarily have noticed ourselves. It was valuable for the residents because they got a chance to share their views on how the service is run with someone other than ourselves. So it's been quite valuable. We've managed to make a few changes off the back of it and make the home a better place for everyone.
So the Care Quality Commission is the independent regulator of health and social care services in England. Our role is to monitor, inspect and regulate health and social care services and make sure that they meet fundamental standards of care. So in adult social care, a really important part of that role is to gather the views and listen to the views of people who use those services and their relatives. And we do that in a variety of ways, but one of the really important ways is to consider the Healthwatch Enter and View visit reports. These reports are really important because they really focus on the views and the experiences of people who are using the services. So we use the information in those reports in a variety of ways. We use them as part of our ongoing monitoring of services, so that's helping us build up a picture of the quality of care being provided. So if we get a report with some serious concerns raised in it, then we might bring forward an inspection. We use them as part of our planning for the inspections. The inspectors will consider that information and it helps us to target our resources within the inspection, particularly if there are areas that people are telling us that the service does really well, or that areas that the service needs to improve on. We can particularly look at those areas. We also use them, as sometimes refer to them as within our inspection reports, which are then published on the Care Quality Commission website. So in adult social care, it's really important that everyone involved continues to share information. And we find that the Healthwatch Enter and View visit reports are a really important way that we can do that.